Bismillahirrahmanirrahim. Assalamu alaikum. A 29-year-old woman come to the office due to painful sores on her labia. The patient first noticed the sore 3 days ago and has not had these symptoms before. She has also had a headache and intermittent fever for the past 5 days that temporarily resolved with acetaminophen. The patient recently became sexually active with a new male partner and uses a progesterone containing intrauterine device for contraception. She has no chronic medical condition and takes no medication. Temperature is 38 centigrade, blood pressure is 110 by 70 and pulse is 88 per minute. Physical examination shows several clusters of multiple small vesicular lesions on the right labium minora and tender right inguinal lymphadenopathy. Speculum examination is normal. Urine pregnancy test is negative. If left untreated, the patient clinical course would most likely result in which of the following condition: development of mucopapillary rash that include the palms and soles, inflammation of the liver capsule and resultant perihepatitis, persistent lesion with no additional sequelae, progression to central nervous system infection, spontaneous resolution within the next week, separation of inguinal lymph node, and formation of bulbs. So this patient is 29-year-old woman. She came to the office for the evaluation of painful sores on her labia minora. She also had headache and fever for the past 5 days. The patient recently became sexually active with her new male partner and her temperature is 38. On physical examination, it showed that there is a multiple small vesicular lesion on the right labia minora and tender right inguinal lymphadenopathy. So first of all, what is the diagnosis of this question? The diagnosis of this question is herpes simplex virus. And what is the management of the and what is the management of this? The management of this is that and the immunocompromised patient. And immunocompetent patient, the herpes simplex virus will resolve spontaneously. So here the correct option is choice E. Here the correct option is choice E, that the immunocompetent patient, the lesion will resolve spontaneously. Why the choice E is the correct one? Because this patient painful vesicular lesion with associated tender lymphadenopathy are due to genital herpes simplex virus infection. Primary herpes simplex virus outbreak are often associated with systemic symptoms, for example, fever, headache, more painful lesion that persist for a longer duration, and concomitant urinary retention. Most immunocompetent patients with primary herpes simplex virus have spontaneous resolution of symptoms within a week. Antiviral, for example, acyclovir, valacyclovir, are used to reduce symptom duration and frequency of recurrence but do not eliminate recurrence. Come to the incorrect one. Choice A. Development of maculopapular rash that include the palms and soles occur in secondary syphilis. Choice B. Inflammation of liver capsule and resultant perihepatitis, that is also called Fitz-Curtis syndrome, occurs secondary to chlamydia trachomatis and Neisseria gonorrhea infection. Choice C. Persistent lesion with no additional sequelae. So persistent lesion with no additional sequelae can occur with condyloma acuminata, that is genital wart from a human papilloma virus infection. Choice D. Progression to central nervous system infection. So in this case, if the patient is immunosuppressed, so a patient will have more frequent severe recurrence that progress to central nervous system complication, for example, aseptic meningitis, transverse myelitis. Choice F. Suppuration of inguinal lymph node and formation of bulbs can develop with lymphogranuloma venereum infection.